I chose Italy for my project. The culture of Italy regarding their view on addiction, they have a consolidated law number 309 in 1990. This established the nation's regulation of distribution, production, and prohibition of drugs. Illegal substances include heroin, cannabis derivatives, cocaine, hallucinogens, and ecstasy. The drug supply penalty ranges from 6 to 20 years in prison with a fine of €26,000 to €260,000. Part 2. Italy is historically lenient and tolerant towards alcohol. Drugs and smoking, however, don't receive the similar sentiments. They're starting to better recognize the public health challenge surrounding these substances and the negative impacts of addiction and addictive behaviors. Italy has begun implementing prevention and education initiatives as well as public campaigns to counter addictive substances habits include for alcohol, smoking, and drugs. So on the first slide, we have drugs and alcohol. For drugs, they are often used for recreational and experimental purposes among the youth. Cannabis is the most used illicit drug with a percentage of 8.5 in 2022. Heroin and cocaine are the second and third most used, and they're typically known as party drugs and part of the nightlife environment. There are high rates of these observed in urban areas. As for alcohol, Italy has what is known as a Mediterranean culture, so wine is a part of their Italian heritage and their daily meals. In 2021, there are 8 million risky drinkers, 3.5 million binge drinkers, and 750,000 that consumed alcohol at harmful levels. Beers and spirits are often preferred over wine for the newer young generation. The youth's drinking habits in Italy are worrisome because they're reminiscent of Western culture. For smoking, 19.3% of the Italian population above the age of 14 smoked. And smoking is a habit more common amongst males than females. Numbers have historically decreased over time, but risen just as equally because of the introduction of e-cigs and heated tobacco products. These have become the number 2 most used in Italy after cigarettes. And these typically attract younger audiences because of low perceived harm, and also they have low to no intention of quitting. Risk factors. We have cultural and social first. Wine and alcohol is typically culturally significant in Italy. Drugs, smoking, drinking are all influenced by peers or peer pressure. Family influence can also play a part because family is an important institution in Italians. Broken families and or poor family influence often influence poor behavior. Socioeconomics also play a role. Poverty or financial instability leads to increased substance use because people are typically vulnerable and look for a coping mechanism. A lack of work, poor education, which equals to less knowledge about the detriments of these behaviors. Psychological risk factors also include having mental or personality disorders such as depression, anxiety, or trauma. People with impulsive, reckless, or thrill-seeking personalities who often chase a high are also considered risky. Connections between substance use and health issues. We have physical on the left here. Tobacco smoking is often associated with lung cancer, respiratory diseases, cardiovascular disease. Alcohol is related to liver-related diseases, hypertension, gastrointestinal cancer, and drugs are connected to opioid overdoses, poisonings, infectious diseases such as HIV and tuberculosis. And as for the right-hand side, we have mental health issues. Substance use disorder and addiction often increases dependence and withdrawal symptoms. Drug use can worsen co-occurring disorders such as psychosis and schizophrenia. All substances linked to increased depression, anxiety, and suicidal thoughts. So 6 options for primary prevention solutions. Number 1, increase the legal drinking age from 18 to 20. Number 2, increase prevention programs for younger ages, such as creating a substance abuse education. Number 3, create public health campaigns for mass population with flyers. Number 4, increase the number of service facilities, which also speaks to affordability and accessibility. Number 5, strengthen and reinforce age restrictions for substance sale and use. Number 6, challenge social norms and address stigma that normalizes substance abuse or use. Secondary prevention solutions. Number 1, apply routine screening for substance use in healthcare facilities. This can also be at school or work facilities. Number 2, increase support groups and peer outreach programs. Number 3, use technology and social media to create ways for self-monitoring. And that is it for my references. Thank you so much.